Friday, June 16th, and it must be time for another legislative update from your North Carolina Medical Society. It's been a nutty week. I want to update you on one thing that was really smooth and then one thing that was really crazy. The first is the STOP Act, House Bill 243. We've been following this all along, keeping you very up to date on the changes. The House bill has now gone over to the Senate and passed through the Senate Health Committee. The big difference that I'll point out on this week's bill, the changes in this bill, is the fact that there is no longer a requirement for everybody to be on a long-term pain management plan if you're taking pain meds for more than 30 days. Most of the rest of the bill is intact as it came over from the House. There have been some slight tweaks and changes around the edges, but that's the biggest thing. There's also a change in the supervisory agreements as far as what a PA or an NP will have to go and talk to their supervising physician about when the circumstance would trigger for them to have to do that. That's only if they're going to be working in a pain management center. So we expect this bill to go back to Rules Committee in the Senate, which is now their custom, and then to be on the floor of the Senate sometime next week. The crazy bill that happened this week, and I want everybody to take a moment and get your blood pressure medicine in and working before you watch the rest of this video, is House Bill 403. All right, this bill started off as an LME update bill. The LME, Local Management Entity, Managed Care Organizations, the groups that manage mental health in North Carolina. But after that bill passed the House and went to the Senate, the senators have chosen to change this bill into not just a bill that would affect the LME MCO structure in the state right now and the way they're governed, but would also change the entire way mental health is folded into Medicaid reform and change significant portions to the 2015 law affecting Medicaid reform. The two pieces that I testified on yesterday are very important pieces to you and your business. The first are the Chapter 58 protections, and we have been over and over this. You guys know it as good as anybody. These are the insurance law protections in the statute for the state of North Carolina that make sure that your patients and you as providers have protections against bad behavior from the insurance companies. We fought like crazy to get those into the Medicaid reform law. There was agreement to do that. A provision in the new proposed committee substitute that was just passed out of Senate Healthcare yesterday would eliminate the Chapter 58 provisions in lieu of the federal rule. We believe that the federal rule is applicable. The new federal mega rule for Medicaid is applicable, but should not replace the state statutes. That doesn't give you the predictability or the remedies that we think are necessary to make sure that you get treated fairly as we move into managed care for the Medicaid community. In addition, we don't think that there should be a double standard for recipients, whereby if they have commercial insurance, they get treated one way, and if they get Medicaid, they get treated another way. So we'd like to see that uniform going forward. The second provision, and this is the one I think that you're going to lose your minds about the most, is a provision in the new proposed committee substitute for House Bill 403 that would affect your contracting with the new prepaid health plans. The provision says that if they offer you a contract and you refuse to take it, that you are automatically enrolled as a provider in Medicaid at 90% of Medicaid fee-for-service. It doesn't stipulate exactly which fee-for-service schedule, whether it's the current one or some previous one. It just says 90% of fee-for-service. We understand that the legislative intent was to make sure that everybody was a part of all the different plans. All right, that's important. We understand that because we're going from one plan to multiple plans, and we don't want people to be able to cherry pick which plan they want to be a part of and therefore eliminate the ability for others to create networks. So I kind of understand that. I kind of understand the idea that they're trying to get you away from fee-for-service because we've been talking about value for a long time and moving you to value-based contracts or incentive-based contracts. But this sets it up so that the insurance company can basically offer you anything. They could offer you any bad contract that they could come up with, a 10% contract for fee-for-service, a 91% fee-for-service contract, and if you refuse it, they've automatically got you. You have to participate if one of their patients shows up at your door, and they get to pay you 90% of whatever this Medicaid rate is. We oppose this, of course. So we're going to be sending out an action alert so that you can communicate with your senators about this because, as I said, we raised this objection. You can see the objections that I was able to raise in just 2 minutes in committee yesterday on our social media platforms and on our website. But we want to make sure that you have a chance to communicate with your senator before this bill comes up the first of next week, either Monday or Tuesday, sometime early in the week we would expect. So be looking for your action alert, communicate with your legislator. We're going to try to get this either out or fixed, and we'll be updating you more next week on this and the many other things that are moving, as we expect the budget will probably move next week also. So a lot of the changes that will be coming up in the budget we'll be describing for you next Friday when we get together again. So we hope you have a great weekend. Happy Father's Day to all you out there, and we'll see you next week.